All right. Good. Thank you. Good morning. I've got a lot of paperwork up here. Gotta find my. There it is. All right, thank you. All right, it is the 13th day of June, 2025. It's 10 a.m. We are in the County Court at Law courtroom located at 2718 Highway 35 North, Rockport, Texas, 78382. I call this workshop to order. Roll call.
Commissioner Cheney,
Here.
Commissioner Casterline.
Here.
Commissioner Russo. Here. Commissioner Dutnick.
Here.
Judge Garza.
Here, we've got a full court. At this time, we'll hear from citizens to be heard. We've got County Clerk Misty Kimbrough up first.
I'm here to speak on the request to remove the health benefits to be paid between the employee retiring until they reach 65. That was something that was promoted to me when I was deciding whether or not to leave Christus Spawn. I wanted a job here in town where I lived. And that was one of the things that really helped me make the decision to come to this county. I have promoted that to every single person that I've hired. I've promoted to all my employees. I have a single mom of two who food budget every single month is $400. We cannot keep taking away benefits. We cannot keep pay so low that people are going to have to leave this county. Valuable employees. If we keep doing this, they're going to have to leave our employment. They're going to have to move somewhere else so that they can feed their children. I fight for pay raises. Y'all want to take benefits away. You fight pay raises. You give money to nonprofits. You even request more money for nonprofits. But if we don't have employees who can live here, what good is all of that? There are other ways to cut costs. Watching the courthouse from the beginning would have been a great way. And I'll give for instance, my first official day in office when I was doing Commissioner's Court, after court was over, I was told that that $32,000 coffee bar was going to be in my office. If I had known about that even one day earlier, I would have stopped it. If I had been told that before the meeting happened, I would have stopped it. My office shouldn't even have a sink in it, but it does. There are other ways to cut costs. Don't take more benefits away from our employees, please. I have a letter to read from my employees. Hello, we are writing you today on the matter of taking away benefits from current employees. All the current employees were hired with the benefits that are currently in place, including retirement benefits. We have accepted our roles in Aransas County on what was offered to us for now and in our futures. Some of us left jobs to come to work for Aransas County because of these offers and benefits. Taking away a benefit that has been an expectation for your employees the entire time they've been employed is not right and will affect our lives tremendously. Some of the employees have planned a future upon these benefits and what was promised to them upon hire. Taking that away puts that future in jeopardy. How would it work for past employees who have already retired? If this decision passes, will that benefit be taken away from them? It's not known. If the reason for this discussion or decision is to find more money in the county budget, then it needs to be done another way and not taken away from the very people who work to take care of the offices, make this county run, work day in and day out for this community. The fact that this is even a discussion is appalling, and we hope for you to make the right decision and stand by the word of what was told to the employees of Aransas County and not jeopardize jobs and employees' futures. Thank you.
Thank you. Now we've got Keith Barrett. Morning.
Good morning. Keith Barrett, 809 Warbler, Rockport, Texas. I want to talk a little bit about the retiree benefits and maybe some unintended consequences that you may not be aware of. If you push back the ability of someone to retire, it may cause problems in your workers' comp. Not all the jobs within the county are sitting behind a desk. You have a lot of jobs like with the sheriff's department, they're kicking down doors and dealing with inmates. You have road and bridge who are actually building roads and digging ditches. You have the transfer station that are dealing with heavy equipment and pulling large cargo boxes all the way to Corpus Christi. Then you also have the maintenance, your facility maintenance crews that are climbing on roofs and dealing with buildings. And all of these jobs are workers' comp codes that are pretty high risk. They're also working in the elements, cold winters and, hot Texas summers. If we start having injuries of these older employees, if this tends to shift our employee base to being much older, or they're staying longer to keep their healthcare benefits in place. If you start having lower leg injuries, knee injuries, back injuries, shoulder injuries, injuries that require surgery or long-term rehabilitation, your workers' comp rates will go up. And those workers' comp rates and those experience modifier rates go across every employee of the county. So you may be saving in one way, but shifting your cost into another category. It was just kind of food for thought. You would hate to think that the only reason an employee is staying is trying to keep their health benefits in action. Because nowadays, with healthcare the way it is, when you go to a medical care provider, the first thing they want to see is your healthcare insurance card. So that was just a thought. I didn't know if you took in consideration that if our workforce starts getting older, that in these higher, I guess, more dangerous skills, that they may start falling out with injuries or long-term health implications of that extended work life with the county. That's all I had. Thank you.
Thank you, Keith. All right, now we'll go right into item number 1, discuss Aransas County. Discuss Aransas County, Texas Association of Counties Health and Employee Benefit Pool Plan Year 2026 Renewal Options. Ladies, good morning.
Good morning. So Lacey Jones and Beryl Patel traveled down today to be with us. They are our TAC consultants, so they'll be going over all of our plan options with you.
All right. Well, good morning, everybody.
Good morning.
Excuse me just 1 second. I'm going to get all situated here. All right. Well, first of all, I want to thank you all for being here this morning. And from the Texas Association of Counties Health and Employee Benefits Pool, we're very excited to continue our relationship with Aransas County and continue providing high quality benefits for you all. I do want to, I know that we had submitted a proposal for you guys that had a few different plan options. First of which would be renewing your current plan of the 1100 NGS plan. And I know that there was a rate increase associated with that. And we also submitted a proposal for an HSA plan option and a BEN plan, or 2 different BEN plan options. Yes, sir.
Could you explain those terms, please?
I'm sorry?
What was the abbreviation that you just used and what does it say?
The BEN, that stands for Blue Essentials Network. I apologize.
And HSA, explain that too, please.
As a health savings account. So those are some different options that we had sent to you guys. And if you bear with me just 1 moment, I apologize. I'm trying to get this pulled up. That way we can actually go over everything.
Are we talking about this right here?
That renewal packet that I had just given you guys is going to go over the alternate plan options that were given yesterday.
It's this, Commissioner Cheney.
Uh-huh.
We're starting out, we can look at this because
Okay.
it summarizes the options.
I've got so much stuff here that.
I know.
Yeah. Yes, sir. I apologize
But-
about that.
Whenever, if I may,
Yes, sir.
whenever you're speaking, don't use acronyms until you said what it was to start with. You know, I don't care what it is, TAC, Texas Association of Counties, say that to start and then we'll use TAC after that. But for citizens that are listening on Zoom and those that are in the future, then, you know, they don't know who TAC is.
You're absolutely right, and I apologize
Please
about
do.
that. So yes, TAC stands for the Texas Association of Counties. And I apologize for using the term BEN, which stands for Blue Essentials Network, and HSA stands for a health savings account option. And I appreciate you making that comment, Commissioner. I'll certainly do
Not
better about
everybody
that.
lives in the world of health insurance.
Yes,
I
no.
do because of human resource experience, but
Right.
it's mind boggling to most folks.
Yes, I completely understand. So if you guys don't mind, I would like to go over your current health plan. Or actually, I apologize. I was just a little discombobulated. We'll just go over that renewal packet that I given to you guys.
Is it-
Again, I apologize. Yes, the one that says Aransas County Plan Year 2026 renewal.
Start with forward.
Yes, you know what? Let's start from the beginning. Let's not go ahead and jump to the middle. I appreciate it. So what we always like to do is just kind of start off with explaining a little bit about who we are and why we're here and the value of the Texas Association of County Health and Employee Benefits Pool membership. It is our size of over 49,000 members enrolled in our plan that allows us to go out to the market and better negotiate rates for you guys. And it is the size that allows us to have great partners with our vendors, which is Blue Cross and Blue Shield of Texas and Navitas. There are 232 different counties and district entities that are in the Texas Association of Counties Health and Employee Benefits Pool. All decisions are made by a board for the benefits pool that is made up of 11 appointed and elected officials from different counties. So it is county officials that are making these decisions for other counties. And our pooling strategy allows us to spread out the risk amongst all groups of the pool, just because our statistics do show that about once every 3 years, you're going to have a hard year. You're going to have some high claims, and your claims costs are probably going to be more than your contributions paid in. So it's all of those counties pulling together, grouping together to help kind of spread out that risk amongst everyone else and keep renewal rates low. Our rating model does go off of a 46-month claims history, whereas the industry standard is between 12 and 36 months. And we do, again, have great partners with Blue Cross and Blue Shield of Texas and Navitas, the pharmacy benefits manager.
Lacey, I'm
Yes.
sorry, what month period did you say you focus on?
We take into account 48 months
Okay,
worth
that's
of
good.
claims history. Yes, we do. Does anybody else have any other questions?
Not yet.
Okay. Then we'll go ahead and move on. So the reason why we do actually want to go over a little bit of your plan history data before we jump into everything else is just so that way you guys stay informed about how your plan currently is performing and has historically been performing. And the reason why we do that is so you know, and we can actually jump in and impose strategies to try and bring your loss ratio down. Now, yes, sir.
Let me ask this question. You're probably going to answer this later on, but out of 49,000 employees, of those 49,000 employees, what's the average cost per employee of what they're spending in the healthcare versus their what it's actually costing the county and the employee. In other words, 49,000, if everybody's using $10,000 of it, that's one thing. But if everybody's using $100 of it on the average, I'm not talking about heart attacks, not talking about cancer.
Mhm.
I'm talking about average across the board. What is the cost to TAC or to the insurance company per employee versus what the employee is paying in benefit or in deductible? Or plus what's is being paid in the total per employee cost? See, how's this, I mean, $49,000 employees to be paying as much as we're doing is a lot of money.
Yes, sir, it is.
It is a lot of money. Are we spending that much money in actual healthcare? You know, I mean, you know, if it's 49 million, are we spending $49 million a year to pay healthcare benefits? Are we paying, 29 million?
I
Yes, sir.
think, and Lacey may address this, but 1 or 2 pages into this, they're going to show what our particular experience ratio is.
Yeah, I understand.
But
that.
I-
Yeah.
I'm talking about across the
I know.
whole employee package.
But I think, and Lacey
Mhm.
can correct that, and I understand why you're asking, Jack, but I don't think they look at it as an overall. I think that helps them have power when they're negotiating contracts, but I think they kind of look at it on an individual county or district basis.
Actually, we look at both
Okay.
because both are very important.
So information is available.
Yes, it is. And I can share that with you.
Good.
So since the health and employee benefits pool is regulated by our board, every year the board gets together and reviews the claims data for the pool as a whole. So all groups who are involved. And they do that towards the end of April to come up and just look at what they predict the market to be like the following year as far as inflation for costs and prediction for claims to come up with what we call the pool needed amount. The pool needed amount is what we would need for the upcoming renewal year. So they did look at the claims history. And again, this was at the end of April for the pool as a whole. And at that time, the pool itself was running at just over 100% loss ratio. And I'll explain what a loss ratio is. What that is the dollars that are coming in and contributions or employee premium. So dollars that are paid in by different counties and districts, and then claims that are being paid out. So what that means is that the health and employee benefits pool was paying out more in actual claims than what was coming in contributions.
Okay, so whenever y'all look, I realize, in my earlier life, I did insurance.
Mhm.
Okay? And, you had cost of the market and then cost of the portions of the market.
Mhm.
Okay, so whenever we're looking at an increase or a decrease or a change, whatever, we're looking across the system of everybody that's a member of that system. Is that correct? I mean, if we need to go up 3% or 5%, then we can look at LaSalle County, or we can look at Maverick County or something like that, and they're all having to go up the same amount of percentage. Is that what we're looking at?
No, sir, it's not.
Okay.
So whenever the board does meet and they come up with that pool needed amount, which this year it was 6%, for the upcoming year, at that point, they have the option to vote to give everybody a flat renewal. Everybody gets 6% regardless of how their plan has been doing, because that would give the pool what is needed for the upcoming year. Or they authorize or they vote to allow individual allocations. So every group is analyzed individually based on their claims data and given a renewal rate based on how their plan had been performing. So everybody is contributing to that pool needed amount based on how their plan had performed. So if their loss ratio was higher than another group, they might be getting more than the pool needed amount of 6%, while the group that had paid less or had less in claims paid out versus contributions might get a little bit below the pool needed amount, if that makes sense. But it does all average out to that 6% just for the pool needed. Does that answer your question?
Well, it does, but, I guess my issue is, like, for an example, I'll just use this for an example, Nueces County.
Mhm.
Nueces County has lots more employees than what we have. And, where theirs goes up, I don't know, I don't care what their percentage is, but if ours goes up $100, does theirs go up a relative amount to the $100 per employee? And you see what I'm saying? In
Yes.
scale, but the scale is equal to the number of employees.
And that would have to do strictly with, what sort of plan they were offering and what their
Well,
premium.
comparable, I mean, I'm just
Yeah.
using that as an example.
Uh-huh.
Everything's comparable, but we have a loss ratio here that's a little bit higher than what they have in Nueces County, and they're a little lower. So
Mhm.
they get a drop. I mean, I realize it's all on an individual basis. I understand how insurance works. But if you're in a pool, if you throw a rock in a pool, you get ripples, but it levels out.
Right.
Okay, is that what we're looking at here? That we're part of the ripple, or are we part of the leveling out? I mean, across the board, does everybody go up X%? Or does everybody go down X%? If for that 48-month average, whatever it is,
Mhm.
they have a really good year or a really bad year, does that affect everybody in the pool?
The costs of claims from other counties affecting, yeah, I mean, it technically, yes, just because it is a pooled approach. So of course, claims from every county is going to have an effect on the pool needed amount. So if the pool sees a great year where we have lower claims that are having to be paid out, and there isn't necessarily any renewal amount needed, we can give a 0 renewal rate. And also if it has been done. It actually was done, let me see here. You know what? I apologize. I was looking at a different figure. As far as a just flat renewal for everyone, I could certainly look into that and get back with you to let you know.
But that indicates that it doesn't happen very often.
I-
They don't hardly ever go down. I realize all the costs go up, and I understand that.
Uh-huh.
I understand inflation, I understand that. But if you get a really significant time period or a couple of years or whatever,
Mm-hmm.
and it goes down, across the board, goes down a little bit, do we get an adjustment?
Absolutely. And that's what I believe that was a figure that I was looking at on my little spreadsheet here. You guys had actually, for plan year 2021, had a 3% decrease.
Okay.
So whenever the pool is doing great and your plan is performing well and we can lower those rates, we do.
Okay, so it's individually monitored.
Yes.
The overall needs across the pool, but individually, the ways and the ways and the ebbies, they level out. So if you've had in this overall scheme, you've had a decrease in your county, your client thing, then you could see a decrease. But if you've
Yes.
had an increase, you can expect an increase.
Absolutely. And the reason for that yes. Yes, absolutely. Desiree had a great point. Is that whenever the pool does have a surplus, just because we are a not-for-profit, so we're just trying to cover the cost of paying out claims and what it takes to administer everybody's plan, we're able to give that money back to the counties in surplus distributions whenever the board does approve it. So nothing is kept for profit or anything like that. It's given back. So whenever we can give counties renewal decreases, that just makes our day. Because, I mean, we know it's tough for everybody. And so we certainly would love for the pool to perform better as a whole. And we've got, wellness strategies and a lot of other things that we can do to try and implement that.
Lacey, there is a page in the packet that we received that shows what the surplus distributions have been from 2018 through 2024. So
Yes.
if you look at the packet they gave us, it is in there. And it also shows what our renewal rates were and where we
Yes.
went down by 3% in 2021.
Absolutely. Absolutely.
Thank you.
Thank you.
Commissioner.
Yeah. I love the questions. Okay. Basically why I'm here is just to inform you guys about your plan's performance, give some alternate options for you guys as far as renewal that maybe could save the county a little bit of money. And I just want to see what sort of goals you guys are trying to hit here in Aransas County and what I can do to actually help you guys with that. And just stay informed about, renewal dates and what all's going on with the health and employee benefits pool. So if we go to the slide that says plan review, this is some data for you guys. Oh, I'm sorry. It's in your handouts and I probably should have gotten something for the screen.
Do you have that, Colin, or no?
I just had Zach email it to you.
Okay.
Okay. I'm sorry about that.
Thank you, Desiree. Zach,
Okay. Do we need to wait for that to be uploaded?
Yes.
Okay. I apologize.
Can I ask you a question while we're waiting on that?
Yes.
On this schedule that you have right here, column that says current plan,
Yes.
is that the price that we're paying right now?
Where it says current plan year, that is where it's the price that you guys are paying right now. And where it says a current plan renewal rate, that's what it would be for, the upcoming plan year if you guys
Okay.
decided to stick with that same plan. So that
Okay.
would be the price effective 10/1 of 2025.
Which one are we looking at?
There we go. It's on the screen.
Okay, perfect. Okay. So the slide that does,
If you can do it, don't put it in jeopardy. Okay.
all right. So the slide that says plan review, that is a data set for the last 12 months for you guys. So just going over your current plan coverage, you guys currently have a medical plan 1100 NGS. So that's a non-grandfathered health plan, and an RX plan. So your prescription plan is a 5ANG. Your current medical deductible for an individual is $750. And the medical deductible for the family coverage is $2,250. So those are just the medical deductible amounts. The prescription copays currently are $10, $30, and $50 for tiers 1, 2, and 3 respectively. And there is no prescription deductible to be met prior to reaching the tiered coverage. Just beneath that, we have your claims experience. So this is that 12 and 36 month loss ratio that we were discussing earlier. Again, the loss ratio is the dollars paid in from the county for contributions for the health insurance versus medical and prescription claims being paid out. And this is strictly for Aransas County. So this isn't for the pool as a whole. This information is just for Aransas County.
Okay, and that includes the county payment and the employee deductible, right?
The
That's just what the county's paying.
that is the entire premium. As far as what employees are contributing for their health insurance, that's more so on the county's end. whereas we look at the premium as a whole. So this is for,
Doesn't matter who's paying it, that's what it is.
right, yes, sir. So the current 12-month loss ratio is 110.06%. So what that means is that for every dollar that's paid in contributions, the health and employee benefits pool is paying out a little over $1.10 in medical and RX claims just for those enrolled under Aransas County.
10% over what you're receiving, you're paying out,
Yes,
which isn't a good business model.
That have to be made up the following year plus whatever increased costs may be.
correct. It certainly does. Well, we certainly want to be able to fund for it more efficiently. So the 36-month loss ratio, so this is over the past 3 years, you guys have been running at 115.13%. So the loss ratio for you guys has been rolling over 100% for at least 3 years. So again, that is that,
And that's with the adjustments in premium that we've been paying.
that is, yes, that's just the entire premiums being paid in versus medical and prescription claims paid going out.
So if we had not been increasing our participation as a county, not I'm talking about the employees, but as an county, we'd be looking at something like 35%.
No, that number wouldn't change. On our end, because like I said, we're just looking at the entire premium.
No matter who's paying it.
It doesn't matter who's paying it.
Alright.
But those are great questions. Thank you.
Interesting subject.
So.
Yeah, it certainly
The
is.
schedule where we have our current plan and the next one under it, it says buy-up plan. What does that mean?
I can certainly get to that
Okay.
in just a moment. Is that okay, Commissioner?
That's fine.
Okay. We'll run through this other information as well, just because this does actually have a lot to deal with, as far as the renewal rates for everybody. So just under the claims experience, we have the credibility formula and factors. So this is, taken into account, and whenever we do those individual allocations for every group to decide the renewal rate after the board has decided the pool needed amount. These are not necessarily factors that you guys have any influence over, but they do have a little bit of weight whenever it does come to the renewal rate.
What does that mean, credibility factor?
And that's, so the credibility factor, you guys have a 60 or 56.8% credibility factor. All that has to do with is the size of your group. So how many people are enrolled in the plan and the length of time that you've been in the pool. And the reason why that is just because the larger the size of your group is, the easier it is for us to be able to predict what the following year in claims might look like.
Right.
And of course, with the history of being with the pool, we have more data, so that way we can kind of project those claims as well.
Is the number 56, is that high, low? What's better?
Um,
Near 100 or near zero?
Of course, it is out of 100. But again, it's just the ability to be able to predict future claims.
So the higher, the better.
Higher the better.
The higher, the better,
Okay.
but 56.8 is not bad. It is not, just because, like I said, it's really about the size.
It's not something we can control.
Right, it's not, but it is something that does contribute slightly to,
the
what, yes, it certainly does. And then your demographic factor, so that has to do with the age of the population of those that are enrolled in Aransas County's medical plan compared to the other lives in the pool. Currently, it looks like you guys are just a little bit older than the rest of the population. And we do know that whenever you do have an older population, they do tend to incur more in medical claims, but it's 0.4%. It's not really much of anything, but it is considered. And then that's really offset by your area factor. And what that is the cost of care in your area. So the cost of care in Aransas County compared to the rest of the state of Texas. So you guys are just under 10% less, which is great because it means that it's a little bit cheaper to get medical care here.
But if you look at these three things together, we're trying to get a longer staying employee base, which is what we're trying to do, more stable, longer standing, not retiring so quick and that sort of thing. Then that's gonna go up. That's gonna be a detriment to our insurance technically, because the older you get, the more expensive you are as far as medical goes.
Right.
So, and so it's kind of like shooting yourself in the foot in one area and you know, and gaining experience and everything else in another area. So you gotta weigh it.
Right. Well, and I do want to point out that these are not huge contributors to renewal rates, but they are factors that do have to be taken into consideration. Yes. Does anybody else have any questions about the credibility factors? No? Okay. So just beneath that, I have a breakdown of some high cost claimants for you guys. And what a high cost claimant is an individual who's enrolled in the plan who has accumulated $10,000 or more in medical claims and medical and prescription claims, I apologize, over the last 12 months. So currently you guys have 35 individuals that have accumulated more than $10,000 but less than $20,000 in claims. You guys have 24 individuals that have accumulated over 20,000 but less than $50,000. 3 that have accumulated over $50,000 but less than $100,000, and 2 individuals that are enrolled in the plan that have accumulated more than $200,000 in medical and RX claims.
This includes employees and their dependents.
Employees and
So how many?
dependents.
What is that total?
As far as,
Look at 35. What is the total people that are covered in the county?
currently you guys have, let me take a look here.
623,000, Bob. That's what the total of
I was
that is.
asking for the number of.
I was talking the number of employees or
Oh.
How
dependents.
many?
Those that
people
are
in
enrolled.
The plan, how many
Total,
lives?
yeah.
I gotcha. I believe that the average for you guys over the last 12 months was about 214 employees. And let me take a look just to see exactly how many lives that was. I apologize. I don't have that right there. Okay, great. Oh, good. Sorry about that. I don't seem to be connected to the internet, so I'm trying to see if I can
That's.
get that information for you.
I would like that information, because I look at that 35, what does it correlate to? That's what I was, a question.
I gotcha. If you bear with me just 1 second, I can get my cell phone so that way I can connect my computer. I apologize about that.
You can, Judge, I don't mind waiting to find it information later.
You don't happen to have a current invoice, do you? Yeah, I think it's down there someplace.
Well, and that's what I actually had the latest invoice pulled up for you guys, but it shows the enrollment, by tier. So let me see. I want to make sure that I got the correct information. This one. Yeah, so it looks like the current month invoice shows 238 employees total.
But that also includes retirees, correct?
Yes. And again, I apologize about that. It seems like everything's taking forever to pull up. But I am on the correct document for you
Get the
guys.
Information to us later. I apologize for slowing up the.
No, and I apologize for not having that. So it looks like the average employee membership for you guys for this plan year, so October of 2024 through we've got data through the end of April 2025 for this. The average membership, so it's employees plus dependents, is 342 lives.
Thank you.
Absolutely. Does anybody else have any other questions about that, or can I move on to the renewal data information? Okay. So I just want to, on this renewal data, I just want to show you guys what your previous renewals have been year over year for the past couple years. So for plan year 2025, it looks like you guys had seen a increase for your medical coverage of 8.1%. For plan year 2024, there was a 4.1% increase for medical and RX coverage. Plan year 2023, there was a 6% increase. Plan year 2022, there was a 9.8% increase. And plan year 2021 is when you guys saw a really good year, and there was actually a 3% decrease in the medical and RX coverage for you guys. So, you know, the 5-year average for Aransas County as far as medical increases go is about 5%. And the 5-year average for the TAC Health and Employee Benefits Pool as a whole, the 5-year average needed amount has been 4.76%. So you guys are just a little above the average. Then just right next to that, we have our surplus distributions. So again, since we are a not-for-profit, whenever we do have a surplus of contributions that aren't have to paid out by claims, our board can approve to distribute the surplus amongst the counties. So that just shows year over year the surplus distribution that Aransas County has received. So for plan year 2024, you guys received $11,673. Plan year 2023, there was not a surplus distribution that year. But the year before, in plan year 2022, you guys received $13,966 back. Plan year 2021, you guys had received $13,692 as a surplus distribution. plan year 2020, you guys received a considerable surplus distribution of $178,302. For 2019, Aransas County received $73,031. And 2018, Aransas County had received $52,663. So again, this is all money that's given back to Aransas County in the form of a check from the Health and Employee Benefits Pool. Does anybody have any questions about any of that data? Okay. So we're moving on. The next slide says financial dashboard, a 3-year look. No, wait. All right, great. Got that one up on the screen. So the financial dashboard, what this is it's just looking year over year. And all of this data starts in June and ends in May. So this is the most current data. It starts June of 2022 and goes through May of 2023 for that 12-month period. For Aransas County, there was a total medical claim spend of $1,551,828.79. The total RX claim spend was $621,615.09. So the total medical and RX claims was $2,173,443.88. The total PEPM stands for per employee per month. And what that is it's a breakdown of what the cost is to Aransas County for each employee per month. Not to be confused with per member per month. This is just per employee. So during that 12-month period, the total per employee per month cost was $832.74. Just beneath that, it shows the year's total contributions, which was $2,224,931.80. So for that rolling 12-month period, the loss ratio for you guys was 97.69%. Then the next 12-month period, we have June 2023 to May 2024. We've got the medical claim spend of $2,628,166.17. Total RX claim spend is $572,958.43. So the total claims, which is medical and RX, was $3,201,124.60 for a total per employee per month cost of $1,232.15. The total contributions for you guys was $2,335,723.46, resulting in a loss ratio of 137.05%.
Lacey, you don't need to read all those numbers, but
Oh, thank you so much.
past,
Okay.
this past.
I know it's like,
Yeah.
it's okay.
So we had a
Perfect.
good year, then we had
Yes.
a really bad year.
Yeah.
And 2025, we have
Not so.
not so good year.
Yes.
So does this good year drop off for this next year?
It,
Since
Well-
3-year, 36-month outlook.
and that's another thing is that is why it is a good thing that we do take 48 months of data into consideration, but we do like to look at what the standard market does look at. So that 36 months. But whenever, we're looking at renewals, we are taking into account, the 4 years of data. So unfortunately, yeah, it would drop off for this time frame, but, we're hoping that we can go ahead and improve, the loss ratio and some claims for you guys. So that way we can have some more good years ahead. So yes, so that contributes to the 36-month loss ratio of 115.13%. Okay, and I believe the next thing that we have for you guys is the alternate plan options. So what these are different alternate plans that the folks over at the Texas Association of County had come up with for you guys to see if we can try and cut costs basically in any way that we can. One of those options that we felt like might be appropriate for Aransas County is offering a dual plan option. And so we want to propose this to see if it's something that would be beneficial to you guys, or if we need to take it back to the drawing board, if something else would be better. The reason why we do want to propose a dual plan option is because you do have what we call a base plan. So it is it's still a great health plan, but it's kind of the entry level health plan. It's what employees can get for the least amount of money. And the reason why these plans do bring the county's costs down is because generally with these dual health plan options, the county is only contributing the employee only rate of the cheaper of the two plans. All of these dual plan options do have the current health plan that you guys have as the buy-up option. And the reason why we had done this is to allow employees to continue the health plan that they currently have, if they want to, and just also give the county another alternative. So if Aransas County wants to renew just the health plan that you guys do have, whether it's a dual option or not, the rates in the renewal plan buy-up option for Plan 1100 NGS is what those rates would be. So this is what was offered in the proposal for you guys, the submission for the RFP, because that's what the renewal rates would be, just to stick with the singular standard plan. And the rates for this plan would also be the same if you guys did decide to do a dual plan approach.
So what you're offering essentially two separate possibilities. One, we could just go with the current plan that we have now
Mhm.
and decide if we want to make the employees pay more or the county's going to pay the difference. Or we could go with any one of the four alternate plans. The county would pay the total for the employee only,
Mhm,
negating what the employee has paid in the past.
mhm.
But then if the employee chose, they could go to the renewal plan, which is the same level of benefits they currently have, and they would pay the increment from whatever the base plan amount is. So say on base plan 2, if we pick that, the county would pay $794.64. And if the employee wanted to stay in what they were currently in, they would pay the difference between $794 and $907.
Yes, if that is the contribution model that the county decided to adopt, that is pretty standard in a dual plan approach. And that's why we did propose this option as a way for, the county to be able to save a little bit of money by paying the employee only rate on a plan that's a little bit less rich. But then again, of course, if the employee or retiree decides to stay with the current health plan, it is a little bit more costly to them. But again, the contribution amount is up to the county.
But so the alternate plans, you're taking some kind of coverage away unless the employee wants to pay it. Is that?
The deductibles pretty much, I think, are what changed the most, right?
Oh, yeah.
Prescriptions are not in that base plan,
They are
I'm
in
sorry?
some of them.
some of them. But if you were to
And-
go with that alternate 2 plan, which is what you mentioned,
I just picked that
Yeah.
as I was just trying to get us to
Well,
move
and
forward a little.
yes,
No, I'm not saying I'm not in favor of the health savings account plan. Looking at these, I think alternate plan 4 is a good plan. And yes, the office visits go up slightly. the prescription amounts stay the same and the deductibles go up. But for years, we've talked about what extremely low deductibles this county has in
Yes,
its plan.
yes.
I will speak up again for my single mothers.
Ma'am, I think Lacey has the floor.
Yes, I will say that you guys do have a very rich benefit plan. A deductible amount of $750 for a non-grandfathered plan is it's outstanding. It truly is.
What is a non-grandfathered plan?
That has to do with the ACA regulations. I'm sorry?
ACA or HCA?
I'm sorry. So the Affordable Care Act that was enacted, and it just has to do with certain regulations about making plan changes and contributions. You guys are non-grandfathered status, so that means, you guys can make changes to your plan. And it also has to do with coverage for preventative care, and there's a lot that goes into that Affordable Care Act. But that being said, prior to that ACA in action, those grandfathered plans that haven't changed since it has been enacted, they do have lower deductibles generally. But again, there are other regulations on those as well. But as far as, again, having a $750 deductible, you guys it's a very rich plan. So of course, in order to bring costs down for the county, the only way to really do that is to increase cost share with the employee. So we do have, the alternate plan one has a base plan. So this would be the cheaper of the two of, plan 1175 NGS. And what that is that it is a Blue Essentials Network plan. So currently you guys have a PPO option where you can go to whatever provider you want without going to see a primary care physician first. The Blue Essentials Network does have a primary care physician referral process. So it certainly would be different than what employees are used to currently.
Is it similar to what the old HMOs were?
It's similar, but it's not the same, just because HMOs were really restricted to geographic areas, whereas and that's what I meant by a BEN plan earlier, the Blue Essentials Network is not as restricted as the HMO networks were. So it does have a more narrow network, but it's not as restricted to geographic areas. And so you guys can see that with that plan, the deductible is actually the same. But with those Blue Essential Network plan, there is no out-of-network coverage.
You can go to your regular doctor you've been going to for years and they won't be covered
If
if they're not.
if they're not in network. Yes.
That's the 1175 plan.
Yes, it certainly is.
Lacey, before we move on, let's take a 5-minute break.
Okay.
It's been an hour, so. All right, we're back from a quick break. It's Lacey.
Okay. So I know that we had just gone over alternate plan number one with the base plan being the 1175 NGS. So with that, again, this could be taken as a single plan on its own, but we would recommend doing a dual option plan with the current 1100 NGS. So if anybody does, or if nobody has any questions, I'm going to go ahead and move on to the alternate plan number 2. Is that okay?
I think you have to. I don't think you want to think that one is good. Y'all?
Yeah.
I don't think so.
We can move on to 3 and 4.
Okay,
Two-
fantastic. I love that. Okay, so the alternate plan number 3 is a base plan. So the lower level plan of a plan 1400 NGS. This is very similar to the current plan that you guys have. It's just a little less rich. And by that, I mean that the deductible amounts are slightly higher. So the difference being that the plan 1400 NGS has a $2,000 individual deductible. I'm sorry?
It's $1,250 higher.
It's higher.
Yes,
higher.
it is higher.
Isn't that that's pretty much an industry standard for a lot of companies, so that $2,000, $1,200, $2,000 is
It's not uncommon.
Yes.
No, it's not uncommon. It certainly isn't. But of course, this does result in cheaper premiums just because it is increasing the cost share from those enrolled in the plan. So it would increase the individual deductible to $2,000 and the family deductible to $6,000. The coinsurance rate would remain the same, and the maximum out of pocket for an individual would increase from $3,000 to $4,000, and for family, it would increase from $6,000 to $8,000.
If I may.
Yes,
Okay, so what we're basically saying, everything on this is countywide, okay? But whenever we get down to this level, it's on the individual employee. I mean, county's not gonna pay the $2,000 deductible.
correct.
So we go from, for our current plan, $750 deductible to $2,000 deductible. That's not saying that's countywide, that is county employee wide, but not for the county itself. So if we were to choose, and I'm not saying we're gonna choose right now,
Mhm.
but if we were to choose alternate number 3, we automatically would increase the employee deductible by $1,250.
No, sir.
That's
And
what I'm not understanding.
okay. Well, then I'm glad that you stopped me. So these alternate plan options are for a dual plan option, which means that you would have 2 different plans. So the base plan, say if you guys did choose alternate plan option number 3, the base plan would be the less rich of the plans, that 1400 NGS. And then the county can offer a buy-up plan, which would be the current medical plan that they have. So they can still choose to stay enrolled in their current medical plan.
I don't think that answered my question at all. If it did, I don't understand.
Oh, I'm sorry.
Forgive
Then,
me.
no,
So-
I
So if
apologize.
if I go in for, just had a heart attack, okay? If I go in for a heart attack and my deductible for that is $2,000,
Hmm.
okay, that's gonna be out of my pocket,
Yes,
okay? Whereas right now I go in, the deductible for that, assuming everything's the same, is $750.
correct.
That's a hell of a lot of difference.
Yes, sir. And that's why the employees would have the option to choose between the 2 plans.
So I don't see it on here. Maybe I'm looking in the wrong place, but if the employee would want to buy it up, where does it show what that cost is?
I actually have that broken down for you guys on the next slide. So that way we can take a look at it.
But it comes out to about $83.50 a month for the employee. If they want to buy up and they're currently, what are they contributing right now, Desiree?
And what I had done on the following slide was I had created the employer and employee contributions based on the county paying for 100% of the employee only rate of the base plan. So the cheaper of the two plans. Currently, you guys have, for the current plan 1100 NGS that you guys have, employees, even if they're enrolled in the employee only plan, are paying $45 a month. So realistically, what this dual option presents is the ability for an employee to enroll in healthcare coverage and not have to pay for it. The county could contribute 100% of the lower of the two premiums for the employee only option, or they could choose to buy up and go with the more rich plan that they currently have. So
If you go to the next slide though, because that shows the plan that we're currently talking about, where it shows the alternate plan 3 and
Yeah.
the 1400. Okay.
yes. So that does show option 3 shows the 1400 NGS as a base plan with the different contribution amounts, and then the current 1100 NGS as a buy-up plan for an employee contribution of $83.46
Per month.
per month.
And that would
Instead-
give them their, I'm sorry,
No, instead of the $45 that they're currently paying. Okay.
Correct.
that would give them the lower deductible if they chose that.
Correct. Yes, sir.
So there is an option for them to keep the deductible at 750.
There is.
Is so low
Yes.
and has been for many years. They'd just be paying the 83.46 each month.
Yes.
And
That's
$83 is a lot of money to some employees, but by the same token, we have to take the employees in as a whole group. And you have the younger population, the insurance isn't as critical as someone who may be older, or maybe someone have a lot of kids, but you have to take the whole group into consideration.
Right. And what we find is that a lot of younger employees who are generally healthier would rather take a less rich plan if they can get it at no cost, just because they may not ever reach that $2,000 deductible, or they might not ever reach the $750 deductible that they currently have. So they'll gladly take the free health insurance if it's offered. So, that's why we did want to include these dual plan approaches as well. And does anybody have any other questions about option 3, or can I move on to option 4?
Well, I just will point out that the county
Okay.
is also absorbing an additional part of the increase based on our experience ratio for the last couple of years. Because right now, what did you say we're paying? We're paying 782. And if we went with that, we'd be paying 824. So the county is absorbing some of the increase in costs.
Yes. Yes, that is correct. And then, of course, option 4 is very similar to option 3. It's a plan 1500 NGS. So, of course, it would increase the deductible even more so from $750 to $2,500, which is, quite a bit more extreme. The family deductible would be $7,500, and the out-of-pocket would be $4,350 for an individual and $8,000 for a family. And then the co-pays increase as well. And so the option 4 you see on the breakdown on that slide for plan 1500 NGS as a base and 1100 as the buy up with the employer contribution of $798.26 for every employee. That would bring that buy up plan for the plan 1100 NGS for an employee who's enrolled in employee only to $109.24.
And
Which
we
I don't
will be
know that my
voting on
math is
this at our next meeting, right? Because we have to make a decision by June 26th.
The 25th special meeting schedule, because he won't be here on the 23rd.
Oh, okay. Well, that's good to know. June 25th. That's Wednesday then?
If you want to do it on 23rd.
Well, we need to make this decision to get it to
Right.
TAC.
Yeah.
Because it says on here by June 27th.
Yes, so June 27th is the day that renewals are due back to TAC. Of course, we want to make sure that the right option is put into play for you guys. So if none of these options are good for you, by all means, let me know and we can see about working something else up for you. But working with our entire team, we felt like a dual option approach would be a good option for Aransas County. Just to kind of help save the county some money as far as contributions, but also still provide employees and retirees their current health care that they have.
And I thank Desiree for bringing this forward,
Yes, appreciate.
and
the work.
Rebecca. Sure she can.
Judge, we're looking at the 25th for a special meeting, you said
25th.
25.
June 25th, it's a Wednesday.
What's our current contribution per employee?
782.26 is the current contribution for you guys.
So the county's looking at paying more with either option 3 or 4.
Yes. Now that's based on, the current contribution that you guys are actually doing. I had sent Desiree an email yesterday where I had kind of done some calculations, but to be totally fair, I was not taking the employee contribution into account. I was taking the premium as a whole into account just because, especially with this, we want to, look at the entire premium. If you guys were to move to the plan option 1 with that Blue Essentials Network plan, that 1175 NGS is a base plan and the 1100 NGS is a buy-up. For Aransas County compared to last year, you'd be looking at a 0.7% increase for the year in total costs, or about approximately $14,500 annually.
But that's, but they have no out-of-network coverage.
Correct.
Yeah, that's proper.
Right. And that's where, we definitely want to make that option available to you guys, but personally, I don't think that it would be the best option for the employees. And I know that we said we weren't even going to talk about the HSA plan, so I'll just move past that. The third option with the plan 1400 NGS as a base plan, and then of course, keeping your current plan as the buy-up, you guys would still be looking at you would be looking at a bit of a decrease in your costs year over year. And this is for the entire premium, just because like I said, not taking into consideration what the employees are contributing. And the decrease would be about 0.4% compared to last year. And so that would be a savings of about $8,300. And then the plan 1500 NGS as a base plan and plan 1100 NGS as a buy-up would show a 3.5% decrease year over year, or approximately 74,000 annually.
You said 8,400 the last time, you meant 84,000?
No, 8,300 because it was 0.3%.
Oh, 0.3%.
Yes, I'm sorry.
I said 3%. Okay, 0.3%.
Yes, 0.3%. So in the grand scheme of things, it's pretty much just a break even, right? Yeah.
Yes. I would just like to make a point. The alternate plan options could be higher, but Lacey was able to talk to finance and waive the 2% administrative fee for dual options. So she did save us money there
Oh,
as well.
great.
So
Thanks,
Thank you.
Not to ask that,
Yeah.
what that plays into.
Yes. So That is, I did go up to bat for you guys just because generally whenever we do have when we offer a group a dual option plan, there is considerable risk involved just because like what I was saying before about how generally the younger, healthier population will enroll in the cheaper option because it's free. And that being said, you're still looking at those that really need the insurance and who really utilize it are still enrolled in the buy-up plan, the more rich plan. They're paying a little bit more for it, but they're still accumulating those claims. So realistically, you still have the same amount of claims, but the contributions are fewer. So generally, whenever there is a dual option plan offered, there is a 2% load rate added on top of what the rate should be just to make sure that there's enough money to pay the actual claims. And I went to bat for you guys and I was like, hey, I feel like this would really help Aransas County. Can we please not have those rates included? So I did get about 2% knocked off of each of those dual plans. So, just trying to do everything that I can to make sure that you guys get what you need. Because I do believe that this would be a really great option for you. Personally, I do think that either alternate plan option 3 or 4 would be best. But ultimately it's the court's decision. Do you guys have any questions for me? Okay. All right. Well, I'm here if you guys need anything.
Got all these papers here?
I know there's so many papers. Okay. All right. Thank you.
Just as a county as a whole and I know, or not. I know Desiree is sharing like healthy county stuff and exercises, and to bring our rates down, we've got to be healthier. I mean, that's the only thing we can do, right?
Yes, it certainly is. And I mean, just like I know that we had met with you and Desiree before, and that's what Beryl and I are here to do, trying to help promote wellness. And I know that Desiree is doing a fantastic job with that. Like Beryl and I were just complimenting her bulletin board in there, which is absolutely fantastic. But just educating employees and letting them know what their options are, what's available to them with their plan is really important too. Because we do have a lot of wellness options that are available at no charge to them that can help manage those chronic conditions that are really driving the claims.
And I would also like to add that, and I think Desiree has brought health and wellness back up to the forefront in her tenure as the HR director, and I let her know how much I appreciate that. And I know when I was the HR director, I did that. And when I went through new employee orientation, I emphasized get an annual checkup. It's essentially free, and participate in these healthy county things because it will improve your lifestyle in the long run. And I think we saw that in some of our rate reductions for a while. And I think
Yes.
we'll start to see it again. And it would be good if the elected officials and the department heads would take this to heart and encourage their staff to have healthier practices, because they have any number of programs that help if you have diabetes or COPD or any number of health chronic conditions that can ameliorate those. And I mean, TAC is an excellent partner for us, and I'm really glad that we're using you again.
Yes, thank you. And Desiree has done such an amazing job about promoting those different wellness products that we do have. And I know, we're here to help any way that we can to continue that initiative. And Commissioner, you're absolutely right. It really does. It starts from the top and trickles down. So whenever we do have, the court that's on board with the wellness initiatives, it does trickle down and it does have an effect on the employees, and it does really encourage them to be involved and care about their well-being, because that's really what it's about. It's about taking care of your employees. Okay, thank you. Thanks so much.
You have some.
Yes, so I also sent y'all the retiree analysis. Did y'all want to take a break from benefits, like a short little break, 2-minute break before we go over all the retiree portion of the meeting? Or did you just want to
No.
continue? Okay.
We take one?
Oh, did you want to break?
Mm.
No, we'll just
I don't know how that's gonna go.
keep trucking.
Okay, and we did have more employees or department heads that wanted to speak about their retiree benefits. Did you want to allow them to speak first or wait until we're through with this portion?
Who wants to speak?
Daryl?
You're talking about this,
Yes, for the
what we're talking
retiree,
about now
Yes.
or the previous ones that we talked about?
the retiree portion now about how much we'd contribute as far as retiree health benefits.
Daryl, you get up for it.
You know, we have a little bit of an older group, which is a good thing for the county. They're very skilled and knowledgeable of their work. And I know we have several people that are going to be on the cusp of retiring prior to meeting that age 65 requirement for Medicare, ability to get on Medicare. And so, you know, I want to promote longevity here. That's how we get things done in the county. You know, these days, everybody wants to jump from job to job. The younger group of individuals chase money. I come from, you know, working 27 years for a city, and I've watched over the years how benefits have, you know, definitely had to change with the times. But that is, you know, the biggest selling point of coming and working for, you know, a governmental entity ultimately is the benefits. You come into it knowing that you can't compete with the market salary, but you know, everyone has families at home, they have wives, children, and they need to, you know, that's a form of income, you know, keeping those prices down. And I'm amazed coming here, witnessing a PPO plan. Last time I had a PPO plan was 1997. So, I mean, I tell everyone, you know, how wonderful our benefits are. We're 7% contribution to our retirement. That's a wonderful thing too. I interviewed a gentleman yesterday, and, you know, when we had to share the salary, I kind of, you know, had to, you know, put my head down a little bit, but I did promote, you know, our insurance and our retirement. And it is a very important selling point. So, anything we can do to slow the progression of, you know, losing some of the benefits, the better for the county and the better to sell, you know, employees to come to work for us.
And be sure to sell them on the Healthy County programs too.
Yes, ma'am.
I'm
Absolutely.
serious about that
Yes,
because
ma'am.
that is a big consideration and they're available for free.
Yes, ma'am.
But thank you.
Thank you, Daryl. Anybody else? Ms. Marshall?
I just wanted to say pretty much the same thing, because we have, coming from a department, I have a hard time getting staff as it is. I have worked with the public. Working with the public is not easy anymore. It's high stress, high traffic, a lot to learn for the little money that they do make for the work that we do. I do promote the insurance. I do promote all the little extra things that go along with the insurance that I'm a part of. And I also try to promote retirement, because that is, longevity is something I need in my office. So to promote that insurance, to promote that retirement, that is the only way I can get the staff to stay with me. Because once I put all that training into somebody, and for them just to go to somebody else, that's because they're making more money somewhere else, it's hard, because I can't offer the raises to keep my staff when they do go to get another job somewhere else making more money. It's not like I can go, wait, please don't leave me. You've given me 10 years. Here's a raise. I can't do that because my hands are tied. But I can offer that insurance and I can offer that retirement. And me going on my 20 years, I'm looking forward to retiring before I'm 65, because I want to enjoy my life, the rest of it. So that is something I have been looking forward to since I took my position. It wasn't offered when I started with the county, but it was offered there shortly after. And then I have been looking forward to being able to retire before I reach 65 with my insurance so I can retire. So that's something that I don't see that we should be taking it away from the people that are already here.
Thank you.
I'd like to piggyback on what she stated about training people. In my office, it takes at least a year to become proficient in their job duties. So when I start losing people, it such a stress on our department because it takes so long to train people. And when you're training someone else, it's very hard to keep up with your duties. It is a benefit that I think we should keep.
Zach, you got anything? You good?
I agree. It's a supreme waste of time and resources to hire somebody.
Can you come to the microphone, please?
Identify yourself. We don't know who you are.
I don't want to say anything. Not my thing anyways.
Uh-huh.
Zach Westlake, District Clerk. I guess a year if you're lucky to train somebody, at least in our offices. It's a supreme waste of time and resources to spend all that time to train somebody for them to just leave because, again, they found a better job. The turnover, it just drags down production. I agree with everything they said. And the point of good benefits is generally in lieu of lower pay. And not much incentive for you to come and work for the county when there's no incentive or lesser incentive.
Thank you, Zach.
So after our commissioners court where it was brought up to remove retiree benefits,
To
insurance
discuss,
benefits.
to discuss.
Yes, to discuss. Yes, ma'am. A lot of employees reached out to me regarding the issue. So I wanted to come up with a compromise where the county saved some money and employees were still able to have retiree health benefits. So I created an analysis to show, it's the blue template. I'll wait for Colin to pull it up.
And you said the blue, right?
Yes, ma'am.
Okay.
Okay. I know it's kind of hard to read. It's small. But I just wanted to show how many employees are currently, or retirees are currently on our health insurance, and it's 10 that we're covering. So annually, that's about $93,000 that we're paying towards retiree insurance. And on average, the retirees utilize this insurance for 5.43 years. So it's not an extended amount of time for most of them. So on average, it's about 5 years. If we went to a tiered system where we reduced the amount paid towards retiree health benefits, that would save the county about $25,000 per year. And the tiered approach that I'm proposing would be the county pays 50% of retiree health insurance if they have 8 years vested with us, 8 years of service with Aransas County. 70% paid if they have at least 16 years, and then 90% paid if they have 20 or more years. And then I just utilize the current retirees on this analysis just to show the breakdown and how much we would save.
Current retirees would not be affected.
No, the current retirees would not be affected. This would be something
Just
going
going
forward.
Right.
Yes.
So did you put, personally, the one thing that I thought that should be different is I think it should be more than 8 years to fall in for this. I know we had one person
Mhm.
that's on here that didn't work for the county very long at all
Right.
and actually knew about it, I think, and came to work here just to qualify for that. And that's when it was changed to the 8 years at that
Yes.
Yeah.
point. So I don't know, to me, I kind of feel like that number maybe should be bumped up a little bit.
Yeah.
Okay.
Uh,
And yes, I just want something for us to compromise on. This is just a starting point and we can definitely change it and negotiate it.
8 years is basically an employee to be vested with the county. I
Right.
think it needs.
Yeah.
I mean, this is it's a
It's a
large
great
amount
idea.
of money for
Thank you.
somebody that only worked here 8 years, if
Yeah.
they were to.
I really appreciate, because when I first saw this, I wasn't exactly sure what all you were talking about, but now that you've explained 8 years of service and 16 years of service, I think it's a very, very good idea.
Okay, thank you.
And it still has a point system. Basically, you have to consider, we'll say age. And would you explain the point system, basically?
So for 75 years of service, or the 75 rule, it would be years of service plus your age.
And that's TCDRS.
Yeah, so TCDRS, it's either the rule of 75, 30 years of service, or age 60 plus the 8 years of vesting. So I mean, that'd be 68 total, but they have 3 different ways to qualify for retirement.
But those numbers, somebody could work somewhere else and accumulate.
Yeah.
Yes.
Yeah.
That's the issue that I have with it is we had the one person that had those numbers from somewhere else,
Mhm.
found out about this deal, came in, worked here. I don't know if she worked or whoever it was, worked a year or not.
2.5
And
years.
it's on this list, yeah.
I included her at the top of the spreadsheet on the top table at the bottom where it says no longer covered. That's that employee. So she worked here for 2.5 years and we had her on our insurance for a little over 5 years.
May I add something? In this, and I think I've talked to Desiree about this tiered approach, and I thought it was good. When I worked for the city, what they did was this, it wasn't 8 years anywhere where you could be vested. It was you had to work for the city. You
Right.
had to give that city the 8 years, and it was in their policy.
I kind of feel like that the years that somebody worked here needs to be more than 8.
Yeah,
That's-
like 10,
Okay.
maybe
Yeah.
10, 15 and 20.
I think you could probably take care of that within the policy, saying they must
Mhm.
be,
Yes.
employed with the county for those 8
I
years
think, yeah.
or
Yes.
whatever.
I agree, because I think
Yeah.
once you get somebody like that talking about the amount of training and stuff, and this kind of helps a return on your investment in the employee.
Yes.
Right. And just to reiterate what everybody else has said, I think it's good.
It's good.
Me going on my second retirement, and the reason that I've stayed in the positions that I'm in is because of the insurance and the benefits. I mean, you can't go anywhere without, and get the benefits that we get, and that's what we have to offer.
Yes. And my tiered approach is just for years of service with the county. I didn't mean to include any other service anywhere else.
I think this was a great proposal, Desiree.
Thank you. It's a good starting point.
Yeah.
Do we pay 90% of the retirees right now? It's not 100%.
We pay 94.6% right now.
94.6?
It's whatever the employee currently pays for health insurance, the retiree pays that as well.
Okay.
I mean, it
there-
fluctuates each year depending how much the court wants to pay towards health insurance. But right now, this year, it's 94.6%.
So if we go to a plan where we have a base plan and an option plan,
Mhm.
then the people that are on here, if they pick the base plan, the county would be paying the full rate for them?
So that's something we'd have to discuss too, because then the billing and everything gets messy. Or Melinda and I actually talked about that. So it's a lot that we'd have to discuss to like fine tune this and what we actually want to pay, whether the base or the PPO plan.
In the
Um,
in the
yes.
corporate world, I know the employee if you retire, you end up paying some out of your own pocket yet. I think we would have to do that to give the employee, if someone retires, the county's portion would be just like a regular employee, and if they wanted to have the better deductible plan, they would have to pay.
In my interpretation of this is with the tiered, after the 20 years that they retire, we're only going to pay 90% of it. It doesn't
Right.
go to 100% like they have
Right.
it here. Your policy for retiree insurance is to pay 90%, so they would still have to pay
Okay, thank you.
$83, what it basically works out to for this one. But I mean, I just
We're
think
gonna offer them
that's-
both,
Yeah,
both
I think
options.
that,
You're saying we would offer the employee, a retiree, a buy-up or not?
well, you could give them the buy-up, but they would actually,
Yeah.
with this paying 90% of the premium, they would still be responsible for that other 10%. And if they want
Either
to buy
way.
up, then they would have to pay the additional. on top
And
of
also they've got Medicare comes into play also at that point in time too for them, right? There's.
Well,
no,
no,
if
if
they
they
hit
65, then they're
Oh,
all,
yeah, all right.
I mean, I'm saying all of this and I'm on Medicare already. So I'm just here for the employees.
Do you have any other questions or comments about that spreadsheet?
No, I think the spreadsheet is brilliant, and I really
Thank you.
appreciate your going into it. I would like to correct something the county clerk said earlier, because I was the HR director when the county clerk was hired. That policy for retirees to stay on health insurance benefit did not go into effect until I left the county.
That's not right.
Yeah, it is. It went into
The-
effect
the
in either
person- the per-
2018 or 20.
No. The person who started this was Mike Gordon.
Right.
Fleet manager for that, and he was getting close to retiring. And he came to you and said, this is the way I interpret the plan. Because every time he would ask you, he would corner me and vent on me with the deal. So after you left, either he or the HR
Yeah.
manager asked for a legal opinion. And the legal opinion said, he's right on the interpretation of your plan. We didn't change the plan until we added the 8 years. The plan was in effect when you were there, just nobody but him ever inquired about it.
It wasn't because it was part of the renewal document and we would check if we wanted to include up
If you
to
want, but we can
65.
bring Mike Gordon down here and.
We can look at the-
because he's talked to me multiple, every time he would ask you, I would hear about it. So it was there, just he was the first one to discover it and came up with a legal opinion to say that's what it said was what he interpreted it. So
The court every year had the option to add it, just like it's in the renewal paperwork. And every year it was checked that we would not offer that. It was an option.
I disagree
that
with
could
you
be
because
offered. Okay.
when you were there, he talked to you about the interpretation multiple times. And after you left, either he or the HR person asked for a legal opinion and were told that his interpretation was the right interpretation.
I would like to see, though, I do think the 8 years needs to be a
Yeah, I would,
higher.
Higher, okay,
10, 15, 20, like Commissioner said, yeah.
okay.
well, I don't think it needs to be 20, but more than 8.
Well, if we did like
No,
50% at 10
15.
years
10, yes.
and then 70%
Yeah.
at 15 and then 90 at 20 or more.
Seems reasonable,
And that's just for employees that are hired after
that are qualified.
this is put into service. After we
Correct.
change this.
Correct. The ones that are already on it are
Grandfather.
grandfathered in, and then whoever retires after this date. We're not looking at hire date when you were hired, we're looking at when you retire. If you retire after, let's say July 1st is when we put this into effect, then these are the new rules.
Well, that's even better. Okay.
Yes.
Okay.
Thank you, Desiree.
All right. Anybody got anything else? Renee, do you have anything?
Well, I have another spreadsheet.
Oh, you do? Oh,
Yes.
okay.
Okay. Yes. So on this one, these are all of our current employees and their retirement eligibility. I cut off employees over age 65 because obviously they can't get the retiree health insurance. And as of today, the top 14 employees would be eligible to retire. But if you look at their ages, 6 of them are over the age of 62. So they wouldn't be on our insurance for very long. So it wouldn't be much of a burden to the county to continue having those employees covered. I just wanted y'all to have this and review it. Do y'all have any questions on it?
I'm not sure. I got a copy of that unless.
Oh, I emailed it out Monday.
Okay, this
Tuesday.
wasn't something handed in today. Okay, I did see that on an email. I-
Okay.
Okay.
Okay. Any questions or comments?
Oh, no, yeah, I was checking. Thank you. Thank you, Madam Clerk.
I didn't want to print that many.
I didn't either. I asked for somebody to put it. I don't have an office, you know.
Okay. Well, thank
You
y'all
know,
very
I have-
much.
Thank you. Thank you again for spreading the healthy county stuff. And I mean, that's the only way to lower our rates because that
Thank
one
you.
good year is going to eventually drop off and then
Yes.
we're going to be looking at a increase again. And
Yeah.
and I'll be honest, like before the past year, I never used my insurance. Now I'm using it because I
Okay.
have to. And
Yeah.
I quit smoking years ago, quit drinking a year and a half ago and exercising. And boy, I feel
You're falling apart now?
Yeah, I feel like I'm falling
Put all
apart
that
now.
stuff.
It's happened
Because your
to
body
Joe.
is going into shock.
Healthy.
The quit drinking part, I always want to get blasted.
Your
and I
body
don't.
is thinking, I might as well die. I don't have.
Yeah,
all my-"
life happens to you no matter what.
But I would like to thank Beryl because Beryl sends me a lot of this information that I share.
Thank you.
And we're actually going to work together to create a plan, like an incentive where employees are more active and they get rewards for being active.
Thank you
So-
both for being
So I
here.
have a question to
Thank you.
Desiree. The thing that I've talked to you about in the past, that I asked Desiree, for people who are Medicare age that retire, they either have to go to AARP or somebody else to buy a supplement. And I suggested maybe we should at least look at what it would cost if we had one that retirees could pay the whole thing for.
Yes.
And because of the group, if it's, maybe it's cheaper to go to AARP or one of these other companies, but it would be nice to, I think we got one in the past, but it was Blue Cross. And like say the state, their normal insurance is Blue Cross, but their stuff for retirees is United Health.
Yes.
And I know my wife had that, and a lot of times her copay on her medicine was less than mine. And so I just thought, even if the employee has to pay for it, or the retiree has to pay for it, at least it's another option
Yes.
for them to use.
I did call United Healthcare,
Uh-huh.
and then they were just the sales team. So then they gave me a number to call for the group team that could help me get the
Okay.
plan that the state
Because
has.
you got the one from Blue Cross and it was real expensive.
It is
Yes,
expensive.
yes.
So does anybody else have that option or?
We do have, our County Choice Silver Plan, which is specifically just like Medicare supplement plan for
Yeah.
retirees post 65. Desiree, we can get together and.
Well, I got it for them and it was expensive.
It is
Yes,
expensive.
yes.
It was about as expensive as the regular insurance.
Yes.
But I know the United Health for the state and other people, maybe even teachers have the same thing. It's not near as expensive as
Mhm.
other, I don't know how it compares to others like AARP or whoever that offer it, but it might be something else to offer for retirees that are over the age.
All right.
Well, thank you, everybody.
Thank you.
Thank you.
Is there, have a motion to adjourn?
Move to adjourn.
Second.
Commissioner Cheney,
Aye.
Commissioner Casterline, Commissioner Russo,
Aye.
Commissioner Dupnick,
Aye.
Judge Garza.
Hi, thank y'all very much.